Good afternoon and evening, everyone. My name is Shibani Ghosh. I am the Associate Director for the Nutrition Innovation Lab. And it's my honor and privilege to be chairing this session where we are going to be presenting the highlights of the work conducted by the lab in generating empirical evidence on the role of governance and in supporting multisectoral actions for nutrition. We're all aware the rationale for multisectorality is that the practical and sustainable solutions for targeting malnutrition requires us to work across systems, implementation levels, and sectors. But in 2010, when the lab started working in this area, there was very little empirical evidence to support and understand the effectiveness of these approaches. In addition, one of the areas that we found interesting was that while you could neatly outline such approaches in a plan or paper, what was very unclear was how such policies were enacted and or implemented at the NIL around implementing such policies. In our panel today, we have three panelists that bring together a wealth of experience in this area, in this space on nutrition science, policy, and programs. I've had the pleasure and the privilege to work with all three of them, and I'm so glad that they're able to join us to share insights on their work and the context of multisectoral governance of nutrition. Firstly, Eileen Kennedy is the former dean of the Friedman School of Nutrition Science and Policy, and she is also a professor at the school. Eileen's interest range from assessing health and nutrition, diet and food security impacts of policy and programs, and nutrient density and diet diversity, along with agriculture nutrition linkages. Eileen has been a member of the high-level panel of experts on food security and nutrition of the UN Committee on World Food Security and a member of the UN SCN Advisory Group on Nutrition. She founded and was the first executive director of the USDA Center for Nutrition Policy and Promotion. Our second speaker today is Rolf Klemm. Rolf is the vice president of nutrition at Helen, Keller International. He's also a faculty at the Johns Hopkins Bloomberg School of Public Health. Rolf has over 25 years of experience working in research and programming around international public health nutrition and has expertise that spans from assessing and testing nutrition efficacy and effectiveness research and programs, as well as supporting policy actions at the country level across several countries in sub-Saharan Africa and Asia. And finally, last but not the least, is Patrick Webb, who is the director of the Feed the Future Innovation Lab for Nutrition and also the Alexander McFarland Professor of Nutrition at the Friedman School. Patrick is also the PI, or used to be the PI of the USAID Food Aid Quality Review Project and has been the Chief of Nutrition at the UN World Food Program. So I'm going to hand this over now to Eileen, who is going to start her presentation, followed by Rolf, apologies, and then Patrick. Over to you, Eileen.
Thank you, Shibani, for that kind introduction. Today, I'll be talking about nutrition policy and governance in Ethiopia. What difference does 5 years make? And if I could have the next slide. I'd like to acknowledge the generous funding provided by USAID through Feed the Future, the government's global hunger and food security initiative. I also want to acknowledge the collaboration of Save the Children Ethiopia, particularly Dan Abbott, Dr. Cherinet, and Dr. Haftamu. The Ethiopia Public Health Institute, which was formerly the Ethiopia Health and Nutrition Institute, and last but not least, the Tufts Innovation Lab, in particular, Doctors Patrick Webb and Shibani Ghosh. Next slide, please. I'm going to provide a little bit of background on Ethiopia. The Scaling Up Nutrition Program, SUN movement, was launched in September 2010 by then Secretary Hillary Clinton at the UN General Assembly meetings. Ethiopia was there, a very active presence, and became what was called an early riser country, committed to participating in the SUN movement. About a year later, a program emerged called Empowering New Generations for Improved Nutrition and Economic Opportunities, funded by USAID and spanned the time period 2011 to 2016. But I want to highlight the commitment to multisectoral approaches to nutrition preceded the ENGINE program. The official launch of ENGINE was in October 2011, if I may have the next slide. And again, the priorities in the government of Ethiopia around multisectoralism has been clear. It was reflected in the National Nutrition Strategy and the first National Nutrition Plan, which was developed in 2008. The multisectoral approach for improving food security and nutrition had an emphasis on the 1,000 days, pregnancy up to the child's second year. And then the program, the approach emphasized both nutrition sensitive and nutrition specific interventions. What I would like to highlight today is nutrition governance, which transcends all of the activities of the first nutrition plan and what we've learned about this over a 10-year period. If I might have the next slide, please. We began the governance study during the engine period 2011 to 2016, and we had a multi-tiered approach. At the national level, we interviewed 24 senior level policy officials, and these individuals were chosen because of the office they held vis-a-vis their involvement in either the development or implementation of the National Nutrition Plan. We had a parallel piece of research at the sub-national level in which we interviewed 307 interviewees, and again, represented a range of relevant stakeholder groups, government, donors, academics, NGOs. And the process we used paralleled that we used in the national approach. A structured interview was conducted at both the national and subnational levels. Next slide, please. 5 years later, the Growth Through Nutrition program emerged, 2016 to 2021, again funded by USAID under Feed the Future. GTN had a similar focus to Engine, but we build on something that happened in the latter stages of Engine, which is the development and identification of what are called model Moderators, in essence, district level units. These were established in selected districts under Engine. And the overall idea was to improve the functionality of governance related to multisectorality. There was an emphasis on establishing coordination bodies. Regular technical assistance was provided by Engine, then GTN, and these were all followed into the GTN project. In GTN, more emphasis was placed on subnational governance, including a focus on capacity development. For the research in GTN, we used structured interviews complemented by key informant interview as well as focus group sessions. May I have the next slide? So what I will talk about now is a comparison at the Moderator level between Engine and GTN. And the emphasis is on three domains. One, the nature of the nutrition problem. Two, decision-making and ownership. And three, challenges and opportunities. Next slide, please. First question early on in our structured interview, what did our interviewees see about as the nature of nutrition problems? And in the bottom of this graph, we stratify this first by regions, the 4 regions in which we conducted the research, but then we stratified by sectors, health, economics, social, and partners, and agriculture is included in the economic category. Now, regardless of which region or which sector one looks at, the highest of these bars is always the blue bar, which is malnutrition. And indeed, many of the respondents went on to talk about not simply malnutrition, but stunting as the particular form of malnutrition. If I may have the next slide. 5 years later, when we look at the major nutrition problems identified, first of all, there are a greater range of problems. And if you see about 4 lines from the bottom, malnutrition, yes, is still there, defined by the model Moderators as well as the non-model Moderators, but at a much lower level of, not to say importance, but significance in the cadre of nutrition problems. And Patrick Webb already talked about this in an earlier presentation beyond stunting. Clearly, stunting is important, but as these Moderators had experience implementing their multisectoral plans, they realized there are a much greater range of issues vis-a-vis nutrition, which with they had to deal. And you see here, awareness of good nutrition was a big issue, unbalanced diets, understanding the importance of utilization of nutrition services. So there was a much more nuanced approach to identifying the nutrition problems. Next, please. Second domain we wanted to look at was decision-making and ownership. And again, the first study engine. If you look at the second column here, not consulted, you see in the 4 regions anywhere from 42% to 67% of people interviewed were not consulted or not involved in the development of the National Nutrition Plan. The sidebar note there, 19% of all respondents had no idea what the National Nutrition Plan was, including 16% of those in government. Next slide, please. If we go to the last line of this slide and look at model war rates, what we see there is now it's only 33% of respondents who had no idea about the National Nutrition Plan. So progress. When we compare that to the non-engine, non-model war rates, it's almost twice the level. About 62% had no knowledge of the National Nutrition Plan. So model war rates had a sense of what this was all about. And when then we look at participation for those who participated, the areas are the same, whether it's model or non-war rate areas. That the biggest area of participation was implementation or evaluation of the plan, followed by implementing nutrition-sensitive agriculture and or water. So similar level of involvement, but greater awareness on the part of the model war raters on what the plan was. If I could have the next slide, please. The third area was challenges and opportunities. And here in the engine study, we again look at the 4 regions involved, and across the top, you see the major categories that were identified as implementation challenges: budget, lack of professionals, lack of attention, low awareness, coordination. And I'm not so much interested in those categories as I am in highlighting the fact that the emphasis put on these particular challenges varies quite dramatically within the 4 regions. In budget shortages, for example, we see that in Oromia, only 15% of respondents saw that as a challenge versus almost twice the level or more in the other 3 regions. Go over 4 columns where we see low awareness. Again, Oromia didn't see low awareness of the plan as a particular challenge, whereas SNMP and Tigray, very high levels, reported low awareness as a challenge in implementation of the multisectoral plan. If I may have the next slide, please. Similar to the nutrition problem, as we get into challenges and growth through nutrition, we see a greater array of challenges laid out. And I want to take a little bit of time beyond budget, which normally comes out, to look right below budget, talking about lack of collaboration, coordination in the model war rates. That may sound counterintuitive, since in the model war rates, there was so much attention paid to functionality of governance. And again, a couple of lines down, lack of strong leadership, much larger concern in the model war rates versus the non-engine war rates. Again, this may sound odd, given emphasis on building governance. And I think a part of what we see in the next slide explains it. And we get this, next slide, please. We get this, that from the key informant interviews, that the model war raters became much more aware of the constraints to effective governance. And when we take the flip side of this, factors leading to improved collaboration, indeed, issues like establishing the nutrition coordination body, which was a key focus of GTN, rose to a very significant level as important in accomplishing this multisectoral approach, as were issues like improved coordination and shared planning and capacity development. If I may have the next slide, please. So let me conclude. First of all, designing and implementing effective governance structures at all levels takes time. And we heard this, I have to say, over and over again from the individual key informant interviews, as well as the focus groups. We got statements like, what may take national level government 2 years to design and implement may take 4 to 5 years at the war rate level. And so sort of a flagging the issue of takes time, and this issue needs to be articulated not only to governments, but also to donors. Second, the importance of inclusion. And we saw from that last slide that leadership at national and subnational level is critical. and not only leadership, but at the highest levels. Again, over and over again, at the Moderator level, what we heard is it's useful to have a sector other than health or agriculture leading the coordination body. And often the most effective was the district administrator, because then it was seen not as in the domain of one sector. I haven't talked about the national research, but one key finding there was a recommendation out of our research, and it would be presumptuous to think our research was the only factor, but part of our research flagged the issue of the National Nutrition Coordinating Body, national level, would be better served by being coordinated beyond health, which was the initial chair of the coordinating body. And indeed, it moved to the Prime Minister's office, and it had a very different perception as more inclusivity of all the sectors. 3 changes are incremental, not draconian. 4, think multisectorally, but act sectorally. And this became very clear in working with the local Moderators that although we have a multisectoral plan, activities are carried out by sectors. Budgets are allocated by sectors, staff work within sectors, and that the framework or the overall umbrella is the multisectoral plan, but it still distills down to what does each sector need to do. And the final conclusion is we need regular revitalization, rejuvenation as we go forward. Average tenurial status at the Moderator level in any of the job categories was a little less than 2 years. So every 2 years on average, staff are turning over. So we constantly need to revisit what is it that effective governance means and what kinds of capacity development and training are needed. Thank you. And I'd like to now hand over to Rolf.
Thank you, Eileen. So good afternoon and good evening. I have to chuckle a little bit about being asked to speak about multisectoral governance in a large project like Suahara project in Nepal, because in my own domestic kingdom of 2, my wife and I'm only the vice president, and I find myself mostly governing by saying yes, dear, and agreeing with all of her choices. After all, I was one of them. But seriously, governance can be messy business due to competing interests, different perspectives, capacities, timelines, budgets, and multisectoral governance can increase the mess exponentially. Just quickly to acknowledge, Helen Keller has had a very close relationship with the Nutrition Innovation Lab, and it's really benefited from that. All right, next. But for a moment, I'd like to examine a framework that I constructed for this talk, just to illustrate a few issues. As we've already heard, there's broad consensus for multisectoral governance and action that's needed to address the underlying causes of nutrition, and various sectors play different roles and levels of intensity. And obviously, agriculture has been central because of the role of food to good nutrition, and health for its role in delivering nutrition interventions to women and children, and there are many other sectors. Next. In theory, with the right enabling conditions, sectoral plans, targeting, resources, and actions can be coordinated. Next. But what are those enabling conditions? Probably high political commitment, clear political mandates, a coordination mechanism, financing, a clear delineation of roles and responsibilities, joint accountabilities, and adequate capacity. And in theory, next, these would lead to intersectoral mechanisms to cooperate, communicate, collaborate across sectors with the ultimate aim of improving the delivery of evidence-based, context-appropriate, and effective delivery of multisectoral interventions. Next. And ideally, these mechanisms would be aligned both from the national and to the local level, or vice versa. Next. Next. And ideally, there would be a monitoring system that would assess whether and how well multisectoral actions reach high-risk households and communities, how responsive they are to needs, and would feed back to the higher levels in an iterative process to improve enabling conditions and intersectoral collaboration. Next. So I'd like to move from theory to reality. And I'd like to draw on the multisectoral governance using examples from the Suahara 2 program in Nepal. Next. Many of you have heard about Suahara 2 program, or the Good Nutrition Project in Nepal. It is truly large scale. Next. It covers well over half the country, 42 districts, 389 municipalities. It employs 1,000 frontline workers, works with 40 NGO partners who operate at district government levels, and collaborates with more than 20,000 community workers like the female community health volunteers, and is financed to the tune of $71 million over 7 years. Next. One of the 4 results areas of the Suahara program is to accelerate the rollout of the multi-sector nutrition plan. And I just want to highlight and really praise the government of Nepal for developing this very early on, because it has provided important guidance to Suahara and to other programs. So to their credit, and guided by the plan, messaging and advocacy at all levels of the importance of 1,000-day window is known from and is widespread, and is known at all levels. And it's repeated and communicated by frontline workers across the sectors. Next. From the Suahara perspective, our role in helping to accelerate the plan rollout is being done through essentially capacity building at subnational government stakeholders, facilitating co-planning and budgeting workshops, and other strategies with the goal of transferring and fostering ownership of key program components to local stakeholders. Next. And one of the markers of ownership is local government investment in nutrition. And this has been a focus of some of Suahara's governance work, and I'd like to speak about this in greater depth. Next. So next, on the government front, Suahara uses multiple strategies. Prior to the devolution process in Nepal, Suahara targeted 42 districts under the project. But after the country made its historic move from a unitary form of government to a federal system, Suahara had to transition to target 389 municipal governments who, due to devolution, wield greater power and resources. So we held advocacy workshops, and at the local level, groups that had previously not been aware of existing government grants, awareness was raised. Suahara raised this with group leaders, and particularly among group leaders that weren't of traditional power-holding groups. Next. We participated in annual planning and budgeting workshops, but more than that, we got groups to participate in that process from the local level. And interestingly, many groups have to be registered, and small farmer groups don't normally register themselves, especially among women. So there really needed to be assistance in registration and being able to propose things in a way that they could be considered by the local government for investment. Next. We then organized sustainability workshops, and as devolution evolved, these workshops became more important. And we had to think about which political party was in power at the local governing level, and match, in many cases, the kinds of activities or investments to the party's political mandate. And since devolution, almost all of the deputy mayors are now women. And so Suahara used that fact to leverage women as deputy mayors to be champions for nutrition. Next. We also provided need-based support, and this implies the need for flexible funding and adaptability to contextual issues. Next. And we conducted citizen awareness campaigns to make people aware of grants that were available, to help them register, to work with them to develop evidence-based, costed, but simple proposals. Next. So what were the results of the Suahara's effort? In academia and in politics, talk is cheap. But did these processes result in local politicians and municipalities investing in nutrition? To investigate the question, Suahara conducted a mixed method study to explore factors affecting the allocation and utilization of local budgets for nutrition. The study was conducted in 7 municipalities and 1 ward per municipality across 4 geographic diverse districts. And it used a mixed message, including in-depth interviews, discussions, observations of budget allocation and utilization hearings, and reviewed the actual budgetary documents for allocations and resources. So what do we find next? From 2017 to 2020, we found substantial increases in budgets being allocated for multisectoral investments in nutrition. However, we also found that only 40 to 60% of the amounts allocated were in fact used. Note, however, that the allocated amounts are not small. They're as much as $7 to $11 million. Next. When we examine allocations and utilization by sector, the bulk of these investments went to agriculture, health, and WASH, and less to direct nutrition services, in part because the costs associated with these services are largely supported by non-local resources. But again, we see the large difference between what was allocated and what was actually utilized. Next. When we explored the barriers and facilitators that affected allocation and utilization of local budgets for nutrition, we found, next, that there was really limited management expertise for elected officials, meaning it's really difficult for them to know what to fund, what to prioritize. Next, political influence cannot be ignored. It can perhaps be managed. Next, and that leads to priorities for investing in infrastructure rather than softer investments like nutrition services or the like. Next, there's really limited skills to formulate evidence-based plans. Next, there were delay in budget releases. Next, and tedious reimbursement. And next, no accountability mechanisms for that which was allocated and that which was spent. Next, the facilitators were that the government of Nepal has provided both clear plans, mandates, and guidelines for this investment. Next, there was high community involvement. Next, there was an awareness of nutrition among leaders. Next, and next. There was some leadership skills obvious and data. Next. Now to move forward, next. Moving forward now for Suahara, the next priorities are developing, with the increased power to municipalities, several things have changed. There are no earmarks for social sectoral investments, thus there's even a greater need for advocating for nutrition, which is viewed as a softer and less visible investment compared to bridges, schools, and hardware. There's a need to push to develop municipal and provincial profiles so that mayors and municipal councils can visualize and prioritize problems such, and we have a profile on the right. Next. Again, as mentioned, there are no earmarks for specific sectors, so you really need technical people to be spokesperson at the local level, and that's where technical capacity is lacking. Next. In preparation for a full phase over for Suahara to local governments, we've started using, next, cost sharing and co-investment strategies to leverage increased investment. Next. Finally, a major issue has been the lack of accountability, and this concerns donors, the public, and other stakeholders. Currently, there's no incentive or accountability for governments to allocate money for nutrition, nor is there accountability for assuring that allocated money is released or used. Now, we've started a process of stimulating public hearings to examine how local resources are allocated and spent, but there's much more to do. Next. So a couple of lessons. One, next. Advocacy, I think, as I've indicated, is critical at all levels. Next. There are incentives that are needed to coordinate with other sectors. Next. As Eileen mentioned, collaboration takes time and effort and therefore resources. Next. One might question, is an external agent like Suahara critical to facilitate cross-country sectoral collaboration? I would argue yes, but does it in fact then draw from country ownership? It's a question. Next. Devolution, as we've learned, can really impact on program implementation, its flexibility, the leverage that provincial and national organizations can have on local strategies. Next. We need better documentation of effective strategies to manage actions across sectors. It's an under-researched area. Next. And we also need to learn how external support can strengthen local ownership. Next. We need simple metrics, not just for prioritizing investments, but for what good and functional government looks like, not just whether meetings took place. And finally, we need to find economic ways to sustain capacity. Final slide next. I'd like to acknowledge next the Suahara team, our partners next, and finally, the funder, USAID, and if anyone's interested, we have the publication referenced here. Thank you.
Thank you, Rolf. And over to you, Patrick.
Thanks, Shibani, and thanks both Eileen and Rolf. So we heard in both cases, both speakers started with national level commitments, which are essential, national level commitments to multi-sectoral approaches to addressing nutrition. And then we heard at the local level the many challenges of making that happen. The Woreda level in Ethiopia, the municipality level in Nepal, both happen to be federated countries. Indeed, many around the world are, which means that different parts of each country has different manifestations or burdens of the problem and different capacities for dealing with that problem. And so we can't assume that a single federal policy or program can in fact be implemented in the same way, with the same effectiveness throughout the country. It has to be taken into account that there are going to be differences. And as a result, the effectiveness of a policy or a strategy or a program may well manifest differently in different parts of the country. That was the starting point for this third piece of work, where we looked in Nepal at, to meet Rolf's challenge, we need new metrics. Well, we said, well, could we potentially measure this dimension, the effectiveness of governance, which really means the effectiveness of implementing a policy or strategy. Something along the lines of, for example, the food insecurity experience scale, or the FIES, or the hunger index, sometimes called in the US. Some kind of structured survey that would allow, using a Likert scale of respondents, allow respondents to rate, high or low, a range of questions that would address their perceptions of capabilities and capacities and constraints and concerns in specifically relation to their responsibilities for implementing a program at scale. Now, so we started with both Ethiopia and Nepal at the national level and then very local level, but there's a lot also going on in between, right? Those operating at the Woreda or the municipality level are also relying on what happens in the administrative and bureaucratic sectors above them. And they are also reliant on what happens above them. So in Nepal, we decided to try structured interviews across 8 sectors, the sectors that Rolf laid out, not the private sector, which was his 9th, at 4 different levels, horizontal levels of governance in the country. Now, right now, the country has been reorganized since we've been there into these very large provinces. At the time, it was many more, 75 different districts. And we implemented this study of office holders in several years, starting in 2012 with exploratory surveys, but then in 2014 and 2016. And these are the same locations where we had the household level results presented earlier by Andrew and others. I use the word office holder because, as Eileen said, the tenure of bureaucrats is often short, and it may be different individuals, but the responsibilities of the office remain over time. And so we want to capture what are those capabilities and constraints over time. So the set of questions that was asked using Likert scale responses related to understanding of the nutrition problem and one's own responsibilities in that office at these different levels across these different sectors, the nature and the constraints and the challenges or benefits of collaboration across different sectors and offices, access to the variety of resources needed to do the job well, financial, technical, institutional, capacity, one's own capacity, functional, but also one's own organization, This includes organizations like Helen Keller International, working with them as implementing certain aspects. So it's also frontline workers across the different sectors, and then coordination and support both within and across the different sectors of activity. Now, bear with me here. This diagram, spider diagram, shows change over time. The further to the edge, the outer rim, is better. The closer to the middle is not so good. Blue was 2016, red or orange was 2014. So all this does is identify change in the same office holders over time. Now, what we saw between those 2 years, just 2 years, not Eileen's 5 years, was that when asked about, do you have sufficient non-financial resources, so some of the other resources, technical, administrative, and other, things improved rapidly during the training, implementation, advocacy, and rollout of the large-scale multi-sector program in Nepal. What also improved was the response that, yes, my decisions are increasingly based on technical evidence relevant to nutrition. I have access to that technical evidence. The empirical science matters, and we're basing our work on that. Improvement also in effective collaboration across offices, both within my own organization or sector or ministry, and across sectors and ministries, and that more of the necessary stakeholders are included over time in the nutrition discussion as this multi-sector nutrition plan was implemented. We saw Eileen mention that lack of engagement with stakeholders was seen in Ethiopia as a constraint. So many positives, including a little bit of improvement of support from supervisors within ministries, within the bureaucracy. So you're doing the right job, you're getting it done well. We're glad that that's going on. What didn't, the wrong direction, one could argue, is that over those 2 years, fewer people felt that their own responsibilities for nutrition were well defined, clearly articulated. That could be seen as negative, but actually, it's actually something you might expect as multi-sector responsibility for nutrition rolls out. There's some confusion that can emerge in terms of, yes, but who's responsible for what? How do I achieve this in my own work? And there are a range of domains relating to skills training, training on the job, actual financial resources, budgetary resources in my own office, which barely changed over time. Those are some of the things that both Rolf and Eileen pointed to in their talks. That was not at the national, not at the very local, but at the sub-national, but let's call it district level, right? So there are differences in district and then down to a lower level, closer to the field. Same questions, same sectors. What improved over that same period at the closer to the field was more sharing of information about my own plans and activities that are relevant to nutrition. What didn't work so well was we're not having enough discussion about how to implement level across our sectors. Again, nutrition responsibilities are not being adequately defined. There's a lot of work. And again, no change in budget allocations, skills training, and adequate capacity, my own adequate capacity. So what this speaks to is the potential for replication using this kind of tool, these kind of questions. One can replicate this over time. It's sensitive enough to change over time. And one can identify where there are potential areas of intervention, weaknesses that we can act on, things that need to change to improve and enhance the rollout of activities over time. I won't go into any depth here, given the time, but this index, we're calling it the Nutrition Governance Index, the NGI, we were able to link improvements over time, the things that did improve over time in these different districts, with change, positive or negative, in stunting in those same locations, the same places where those questions were asked of the administrators, and controlling for many other dimensions of household, community, and regional factors playing on nutrition, the index, a positive change in the index by 1 point over time was associated with a really significant higher height for age Z-score, which that we're not claiming that it's the governance index that drove that, but we are arguing that what we're measuring here is effectiveness of what's going on in those locations. And it is associated with improvements in nutrition over time. And that's a pretty significant win. We can also break down the questions were generated through principal components analysis and trying to figure out which clusters of questions work best together. And we're actually seeing that, in fact, different dimensions of nutrition, wasting versus stunting, the different dimensions of those capacities, like nutrition knowledge, understanding the problem, was more associated with improvements in wasting, whereas improved coordination of activities was more associated with improvements in stunting over time, right? So we can break down where in the skill sets, the financial or the other resource sets, we can make a difference. This same the same tool is currently being implemented, tested in Laos. We're actually seeing if it is replicable in multiple countries, both at the national and subnational level. And a bit like Eileen's Ethiopia data, we are seeing awareness of the national nutrition strategy low, responsibilities not clearly defined, adequate training, no, not enough. So very similar activities, very similar concerns being expressed. But this, we will analyze the data further and try and see what are the similarities, what are the differences, but the most important thing being that this can work in multiple locations. So we feel that this metric, this new metric relating to nutrition, is paying off. It's really important, not just to demonstrate that activities are achieving better nutrition, but how and why and where are the weaknesses and constraints to be able to act on those. This tool currently tested in Laos. We've got advanced discussions with the groups in Tanzania and Kenya to also replicate the same tool. So maybe one day down the road, this could become a global tool that measures the effectiveness of what we're doing in relation to nutrition policies and programs around the world, but it could also be used at a programmatic level for enhanced monitoring, evaluation, and learning on program level implementation. Where are the entry points? Where do we need more training? Where are the other technical and financial resources needed? This is out there, it's a tool, and we have several publications, more coming out relating to this, and can share this with anyone who's interested. So I'll stop there and thank you for your attention.
Thank you, Patrick, and thank you, Eileen and Rolf. This is, there are a few questions. We are about 12 minutes, and so I'm going to ask questions of each of you and then maybe have each of you reflect at a higher level to close out the session. So Eileen, I'll just go in the same order as the presentations. There's a question for you from an audience member who says, interesting that Veredas involved in Engine actually reported a higher lack of leadership commitment than those non-Engine Veredas. Does this reveal any important factors that governance strategies should address?
Yeah, and thank you. That's an excellent question. I want to, first of all, it's what was seen as a constraint at the Rolf level. And I suppose that's the negative side, where there was lack of leadership is a problem. But then later on, when they had experience with the implementation, what factors led to better collaboration and their strong leadership where it had happened was a big factor. I just want to add, I should have said this at the end. One measure of success at all levels, national all the way down to the local, is sustainability of these approaches. And the government recently has launched its food and nutrition policy strategy, building on a lot of what came out of their experiences, multisectoral engine, growth through nutrition, highest levels, the coordinations going through the Office of the Prime Minister. But another aspect, which I think maybe was less emphasized at the beginning, was accountability. This gets to Patrick's point about quality indicators, and there really are, as this multisectoral morphs a bit into a food systems approach, spending a lot of time thinking about what are the appropriate metrics for measuring success of implementation and then success in outcomes.
Great, thanks. I think rather than going to Rolf, because Rolf, I have a question for you, but given what Eileen has just said, there is a specific question for Patrick that might sort of lead on to what Eileen has just said. So Patrick, the question is, how would you take this tool for more pointed entry points and advocacy with potential institutions, governments, and other donors?
Mm-hmm. No, very much an appropriate question. At the very beginning of this research, there was some skepticism. Why do we need to demonstrate that better is better, right? So higher quality of implementation is good for nutrition. But when we first presented these results in Nepal, the government people in the room from Ministry of Health, Ag, National Planning, and so on, immediately understood the value of understanding at different tiers of administration, not where the weaknesses are, but where can we strengthen what is already being done. And so for them, it was, okay, right. So in this district, these are the issues that seem to be problematic. Let's focus in on those there. But in this other district, we obviously have other problems. So it's about tailoring as you go in real time, tailoring and adapting your rollout and implementation of large multi-sector activities to try and increase the effectiveness rather than wait for an evaluation at the end. They saw this as a potential tool for strengthening the implementation as it went along.
Great. Thanks, Patrick. Rolf, I think, it was really nice to hear the sort of the governance component, hear about the governance component of Suhara. And, we're very familiar on the Nutrition Innovation Lab with Suhara and its successes. I think the question is, and maybe this is HKI question, or is it a sort of USAID question? I don't know. Is there potential, or is there some thought about using the approach that has worked in Nepal in other country contexts? And what can we do as the community to bring what has worked in Suhara to scale in other contexts?
Yeah, it's a really good question. Just a couple things to note. The investments were high. The number of personnel at each of the levels was high. And to me, I think that that's a real feature of the success. There's another side to that. One is you have, capability at the local level. You have sort of if you will, a neutral broker, if you will, or somebody who could convene. And so that is less threatening to, one sector or the other. So you can facilitate, plays that facilitatory role, and then perhaps with some, structure on and clearly an advocacy voice. So that's important. The question becomes, how does that get institutionalized? And has that role been one that Suhara has taken, and the attempt has been to transfer it and participate? And to me, what that balance is unclear. I did have a conversation with Pooja just before this and said, what if we didn't have these field agents? Would nutrition get priority? She said, probably not, because it will lose out to things that are much more politically visible. And especially now as Nepal embarks on its election season for early next year. And so that to me is a real critical question. So I do think that can work. But I have to give a lot of credit to the Nepalese government, one, for very clear guidelines and mandates for investing in nutrition at the local level, but translating that into actual investments that actually make a difference. And we looked at allocation and utilization, but how it was used and what impact it hasn't, that's really a critical thing. And that we didn't even look at, but that's sort of a next important thing. But local capacity, local data, these are not inexpensive things when you multiply them by hundreds or thousands. And I think to me, we need to do a better job of finding the most critical elements of that and replicating those. and not the nice bells and whistles that may not. And as Eileen was saying, you need to repeat this because politicians change. And so that to me is a huge question. Over.
Yeah, thank you. That's really the last point was what I was going to ask as one of my questions to each of you. One of the one thing that we all face working in this context is that there is rapid change in leadership that occurs. And so what can we do better as a community to, within the context of advocacy and within the context of making sure that even if this is happening, how do we maintain the momentum and how do we bring everybody up to speed so that these actions are not impeded by change? Sorry, I don't know if who wants to answer that question.
Shibani, who do you want to go first? I mean,
well, Eileen, how about you, since you piped up?
Rush right in. Yeah, you know, and this is a reality. There's always going to be a change in leadership, and I think it's nice to have what I call a charismatic personality, somebody who's just passionate about it. Great, but I think we need to sort of also think about how to multiply that by 100. Let me give you one example. When I was doing a lot of the agriculture and nutrition linkages work, agriculture versus health spoke almost entirely different languages. I mean, it was almost like they weren't even looking at the same issue. And one of the real positives I've seen in this multisectoral approach is that there began to be a breakdown of silos. Part of it is these local committees talking to each other. But one example, in a focus group, an ag sector person said, we get no acknowledgement of success. Agriculture in Ethiopia, point of view, has been successful. Look at food security measures. I mean, lots of measures of success. And now we're being asked to be turned into mini ministers of health. And that prompted a lot of discussion of what is it we really want agriculture to do? What is it we want education to do? And so I see, yes, leadership, but I just also think that boots on the ground, there's a lot more discussion going on about what can we do better and differently. And I find that energizing.
Great. I don't know, Rolf or Patrick, if you all have any additional thoughts.
Yeah, for me, it's to focus on things that don't change, the groups that don't change. Farmers associations, yeah, there are technical associations. There are the local scientists who have a care and a passion for these issues, and those, invest in those because politicians and political parties will change. That's a reality that has to be dealt with, and the question then becomes, don't invest all of your eggs in a political approach. But when the political opportunity comes, absolutely utilize it. But you need to focus on whether it's the civil servants, whether it's other technical groups that have a vested interest, whether it's women farmers groups. But I think there are those stable groups there that I think that's what I would invest in over.
Patrick, did you have any thoughts?
Yeah. And you won't be surprised. Focus on the positive. I think the greatest advocacy is not, oh, look, your children are dying of malnutrition. It's really the positives. It's we many decades ago, governments, I heard it all the time, oh, you nutrition people, you can't agree on the priorities or what needs to be done. We do now know what the priorities, and we do have what the priorities are and what can be done. We now have evidence that those actions can work, do work, and will work given the right conditions. And that the positive, the benefits are not just improved nutrition, they're improved livelihoods, improved lives, improved education of children, improved health, improved longevity, improved empowerment of women. And so the multi-win argument is embedded in everything that we do in nutrition. And I think we have to focus on the positive, and the main positive being that we now know what works, and we're actually beginning to do it and do it well. Over.
Great. So with that, I was hoping to have another 30 seconds of each of you, but we are all out of time. So I'd really like to thank all three of you for fabulous presentations and It's always a pleasure to be interacting and chatting with all three of you, even in this virtual forum. So thanks everybody, and thanks everyone who has been watching this session, and we will be commencing our closing remarks shortly. Thanks so much.